I'd really like to thank Warwick. It's fantastic to know that there is such a successful unit. It's a shame that we lost you to the public health system as well, I might say. Warwick, is there anyone who'd like to ask a question? Over here.
Will you be making these notes available to us, please?
Is there a way to do that?
Yes, there is. Yeah, up on the website.
If I just give you the slides or something.
Yep, we can put it on the website.
Okay, they're Mac-based. That's that issue again, isn't it?
Oh, someone will work on it.
What is it about? Is there anyone here who uses Macs rather than PCs for slide presentations? Yeah. Okay.
Would you like to? Is that all right if you could go to the microphone? I'll let you get in there.
Thanks for that. That was wonderful. My name's Antonia. I'm the coordinator at the Australian Centre for the Study of Sexual Assault down in Melbourne. I was just kind of reflecting, and I guess it's a bit of a question as well. There was an earlier comment today around the resistance to acknowledging child sexual abuse and sexual abuse histories within not just the mental health sector, but just within communities generally.
Yeah.
And while I was listening to you, I sort of thought, and to a few others, I sort of thought, you know, who else is kind of sitting there in these conversations that we're having and in the stories that survivors are telling? And it was particularly the comment around the bloke who sort of wrote Freud's biography, and that's the perpetrators and their perpetration tactics. And I just sort of wondered what your thoughts were around, you know, would, you know, having a better understanding about how perpetrators operate, what benefit that might give to both, I guess particularly to sort of shifting some of that resistance.
Okay. As I sort of indicated, that abuse and exploitation will occur in any environment in which it can occur. We have this sort of cosy delusion that we live in a democratic society, and we do, but within that society there are these organisations or groupings that actually don't follow any democratic principles at all. One of which is things like, and has been, things like closed systems like the church. The ones that are most dangerous, of course, are those organisations or groupings that have access to children, so churches, orphanages. But another, a rather really, really worrying one, of course, is an institution called the family, where the people in those settings can't appeal to the local lawmaker or the policeman. There's no option for that. And of course, the prevailing idiom in which all these non-democratic organisations work is that the reputation of the organisation far outweighs the considerations of anybody being abused within them. So the more openness we have, the less that abusers or potential abusers, the less room they have to actually operate. So, you know, in a system where there's so much accountability and so much openness, it actually becomes harder and harder for abusers to actually find their way around actually being able to enforce these closed systems. Closed systems are, you know, they're dangerous. And we think we're a democratic society, but there are a lot of organisations and professional organisations that sort of take on the trappings of star chambers and kangaroo courts and a bit outside of what we see as process of law and democracy. Okay.
Any other questions?
Yeah.
You've just given us a wonderful background to be able to tell our children that it's not stranger danger anymore. It's, you know, your family. And
yeah, of course.
Yes.
It's always been the way that you're much more in danger of your own family than you ever were by some stranger in a greatcoat. Not to say that they aren't a problem, but we also probably just don't fully estimate just how many people are out there that look normal but aren't. The condition that psychopathy or psychopaths are most likely to be confused with is, of course, normality. So abusers look very normal, usually. Okay, thanks.
Thank you. Oh, it's fantastic. Thanks, Warwick.